Hello, my name is Diana Orozco and I'm here with Michelle Peterman, Bill Hornbuckle, and Chrystal Gonzalez, and we're here to present some information surrounding some of the cultures that our new community health clinic might come across. There are 4 different cultures that have a high concentration of individuals within King County, and we felt it was important to explain to our board a little bit more about these cultures. We're going to present them here shortly. The first culture that we have is Indian culture. We have a very large percentage of folks who come from India in King County. And with regards to knowing a little bit more about them, the key thing to take away is that their cultural beliefs, norms, and the folklore beliefs that they have are deeply, deeply rooted into every aspect of their daily lives. The most important component of that is their religion. They have a lot of beliefs and customs and practices that are heavily influenced by their religion. Other important aspects include their language. They're very proud of their language, their diet and dietary restrictions or preferences. Family and social structure is also very important. They have a lot of respect and appreciation towards their own family, and the social structure being, respect for elders as well. A lot of their health beliefs are rooted around holistic or homeopathic health options versus Western medicine, and education is a highly valued aspect of their life as well. With regards to their folklore and religion, about 80% of the Indian population practice Hinduism, which is a very, very large percentage. One can say the majority of people from India practice Hinduism, so that has to be taken into account during their visits at our clinic. Those customs and beliefs are, like I mentioned previously, heavily based on religion. They have many different beliefs that it would take far too long to explain them all. However, methods of prayer to multiple gods is important. They believe in reincarnation. They also believe in karma. Ritualistic cleansing is a big form of healthcare, which is another aspect of holistic healthcare. They also have certain clothing norms that are rooted amongst religious beliefs, but also another big portion of their culture and customs is modesty, particularly with regards to women and or those that identify as female. All of these things have to be taken into account when we're trying to make treatment plans for these patients, because it can alter how beneficial our treatment plans are going to be for certain patients that are from India. Some of the health beliefs that we have researched on is that they believe that healthcare is a fluid and complex system. There are some that believe in some Western medicine, but their primary form of medicine is considered to be holistic, with treatments such as meditation, yoga, massage, herbal medicine, and dietary preferences. They have 2 other beliefs that are probably more common in India itself, but they are instilled within the religious culture for the Indian population. One of them is Unani Tibi, which is a combination of Arabic medicine and homeopathic medicine. Additionally, it's influenced by regional and local practices, which means that someone from different parts of India can have different regional preferences with regards to whatever homeopathic treatment they are choosing to follow. Another one is Ayurveda, which is considered the science of life. And that takes the general idea with that is that there are different parts of your overall health to take into account when you're trying to treat a form of illness. You have to address the physical, the mental, and the spiritual well-being in order to have a balanced outcome with their health. And then lastly, the thing that needs to be considered is that the patients that come in might not 100% believe that their ailment, their disease, their problem is rooted in something that we know to be true, which is bacteria, viruses, or genetic problems. They believe that it can be an imbalance of stress, karma, and other spiritual imbalances. Again, that has to be taken into consideration while we're discussing treatment plans. How we do that is, barriers to health. This differs, so I'm going to touch base on these, but some of these differ depending on whether you're someone who's a younger versus some of our older generations of our Indian population. With our older generations, we tend to have a slight lowered health literacy on specifically traditional Western medicine, versus some of our younger populations can have a little bit more knowledge on traditional Western medicine. Language can be a pretty big barrier depending on how much English they speak. So we have to make sure we have some options for literature and or translators to be able to discuss treatment plans with them. Some of those religious beliefs, the religious considerations to take into account during their treatment planning is some patients, again, related to modesty, might prefer a same-sex healthcare provider. We have to make sure we can accommodate that because of the importance that certain jewelry or clothing is as part of their again, modesty and religious beliefs. We have to take into account that they might not be able to remove certain items of jewelry or clothing. There's a slight hesitation to accept Western medicine, so we do have to discuss the homeopathic alternatives that we could consider to a certain degree as part of their treatment plan. And then to address these barriers to health, we need to create a safe environment for these patients to make sure that they are aware of the different rights that they have with regards to their treatment planning. That can mean making sure we take the time to discuss those cultural preferences, asking questions if they need certain accommodations to certain religious accommodations, always asking for permission before doing any sort of examinations or removing jewelry or clothing, and to a degree, as best as possible, making sure we can adapt our treatment plan to make sure that we take into account those specific preferences. Just because it's something that we might not necessarily understand or agree with, we have to be able to do those accommodations so that our patients can feel comfortable and respected and be more willing to accept our treatment plans. And the next slide that we have here is a little external resource that we can have. Some of these patients might be a little bit more quiet and might not actually voice those needs. And that could be concerning because we want to make sure that we're being as respectful as possible. So this is a little pamphlet that we can present or have out in the waiting room to make sure that they are aware of all of the rights that they have coming into a Western medicine clinic such as ours. And yeah, I'm going to hand it over to Michelle for our next resource here.
So we're going to be talking about the Cambodian culture.
Oh, sorry.
So the Cambodian, we have a high population of Cambodians in King County. They entered as refugees, and during the 1970s, 80s to 90s, they fled the Khmer Rouge after the Cambodian Civil War. Most people were taken to the Philippines, and they were doing acculturation programs so that they could learn English, learn our Western customs, etiquette, hygiene. They received medical care while they waited to be placed in the U.S. The refugees after 1994, they're actually immigrants after 1994. They don't have the trauma that the earlier refugees did that came during the 70s and 80s especially. So moving on to the folklore and religion. 95% of Cambodians practice Theravada Buddhism. Their culture is heavily influenced by India, China, Malaysia, and Europe. They have they value highly hierarchy and proper behavior. The importance is put on duty and family obligation. They combine their ancestor worship and I can't say this, that word, animism and shamanism with Buddhism. They're very superstitious, and they do like to go see fortune tellers, and they do like to receive blessings. So health beliefs, they a lot of people do combine the traditional and Western medicine, and newer immigrants are open to Western medicine, although some of the older immigrants like to still practice things like cupping. Coining is another one. They tend to only seek medical care when they're sick. There's a low health literacy rate, which could also be due to a lot of the low educational, low literacy rate, I should say. They have many culturally based beliefs about medications. They will share medications even if it wasn't prescribed to somebody. They tend to hold on to them and give them away as needed. They also believe in going to temple visits for healing. So they will combine, if they're sick, going to the doctor, but also going to see a priest. They also will seek spiritual healers, and yeah. Oops. So barriers to health. A big one would be the language barrier. When you can't speak the same language, it makes the chance for a worse clinical outcome. So it makes it difficult to navigate the healthcare system. And there's also a shortage of Khmer interpreters. Acculturation stress, just the stress of coming here, not knowing the language, having to find work, and the low health literacy has all added to that. There's also a mistrust with healthcare providers, and some of that stems from some of the trauma they experienced when they were in some of the acculturation camps, and were maybe taken advantage of by some of the authority figures there, and also corrupt doctors that were there. There's a really high rate of mental illness and PTSD in the older adults due to what they saw during those years when they were fleeing and trying to get out of Cambodia. So to address the barriers to health, we need to consider having the use of interpreter services, and it's important to offer the same sex interpreter or ask what their preference is, just like when it comes to what kind of healthcare provider they want, being sensitive to whether they want somebody of the same sex to take care of them. Also to ask if they want their family members included in their treatment planning or being a part of making decisions. It's also some of the cultural differences to consider is the eye contact, tending not to give direct eye contact, and also avoiding unnecessary touching. Handshaking is not customary there. They tend to put their hands together and in a greeting. Also, it's having social support for the older adults is important. There are a lot of younger people that do help take care of their older community members. They'll drive them to their appointments and they'll interpret for them. But for those that don't have family members that can do that, finding a way to provide services to help them in that way would also be important. Also having community wellness programs would be another way to help meet the needs of the Cambodian community, just to help address the high rate of mental illness. So going on to my brochure, this brochure is on just addressing mental illness in the Cambodian culture. There's some signs and symptoms of what mental illness is, and there's resources. There's numbers that they can call just to address this, because it's very stigmatized to and considered weak to have a mental illness. They don't understand what that is. So taking the stigma away from that. And with that, we'll move on to the next culture.
Awesome. Thank you. I think then I'm going to hand it over to Bill. So you can talk about the next one. And Bill, you're going to share your screen, right?
I am, yes.
Okay, cool. Let me stop sharing that. Okay, go ahead.
And here, I hope this does it. Oh, there we are. All right, I'm Bill Hornbuckle. I'm here. I'm going to talk about the Native American tribe of Spokane Indians over on the east side of the state here, where some of our services may be. Basically, it's a small tribe of Native American Indians to this region, part of a little bit of a larger regional area of tribes, mainly in the Spokane area and northwest of that of Spokane. They're about 2,100 in population, so not a very big tribe at all. Centered somewhere around North Idaho and eastern Spokane here. They have some very steep traditions in spiritualism. They're not religious, I would say. They don't prescribe to a certain religion or a god. They're more of a one creator, everything is equal, and they have strong connections to animals, the earth, the sun. They have strong values in family and community, so they may put a lot of value in having family members around, making big decisions, things of that nature, things we'll have to consider in the treatment of them. They do ideals and observations, but they tend to combine that with Western medicine. It seems to be kind of a split between the spiritual needs and illnesses from that perspective on traditional aspects, and Western medicine is more about treating disease brought by outsider, in a sense, as the old thinking was. And they tend to pass things on generationally by telling stories and having discussions and reflections. So much of their beliefs, traditional beliefs, are in Mother Earth and the fact that the Earth supplies all necessities. So a lot of their observations are prayers towards animals, observations of the sun in the case of the Spokane Indian tribe here. They use things like song, dance, rituals, storytelling. Two of the main ones for the Spokane tribe are the Scalp Dance and the Winter Guardian Dance, all part of traditional observations for them. Again, they value community and relationships, and they believe that illnesses in general, not the ones brought by outsiders, are come from imbalances. So they're very much about restoring balance in order to correct health issues. And they may use have that facilitated by traditionally by medicine man or woman. And an unusual thing for them is upon death, the body must be buried, or they're afraid they will their body will turn to a ghost, or their spirit will turn to a ghost. So some unusual things there, and not unusual, but different for some of us. So some of the health beliefs, again, Western medicine's there to heal the body. Traditional medicine is more about healing the spirit. They use things like sweat lodge ceremonies, singing, drumming, powwows, some of their rituals that they like to observe. These are all things that we considered in some of our interactions with them. And again, they believe that chronic illnesses, especially things like diabetes, heart disease, obesity, and addiction, kind of stem from outside sources, and that's some of the things they deal with. Some of the barriers they have to health is a large distrust in government supplied services. since being put on reservations back in early days of resettlements and treaties that were made and broken. They have a strong distrust in what they're told until maybe they're shown that they don't need to distrust. Healthcare services, access to healthcare can be limited. They have the abilities to go to federally funded facilities, but that doesn't always take services to them, and they have to worry about getting there. So geographical distances is an obstacle as well. And they're also one of the most impoverished groups, generally Native Americans in general, no different for Spokane tribe. When they are living on the reservation, they have lower literacy rates, and so much of what we do in medicine, they may not understand as well. And then just a generally unhealthy lifestyle, again, with the income levels and poverty issues there, they're not able to provide for themselves as robustly as they would like, and that leads to lower health quality. So some of the things we need to do to help address this group is gaining that trust and friendship. Understanding that elders have a high position and that they, respecting their position and speaking with families and groups as they wish, listening without interrupting, so they can get they can communicate. They feel like they can communicate with us. Some of the other things we can do is delivery of services, is taking the services to the population, taking things to them instead of making them come all the way to us whenever possible. Developing some co-op maybe of special services or referrals so that they don't get lost after seeing primary care. And then discussing things on their terms go a long way as well. Again, they may not have a lot of literacy with medicine, but if we use simple terms to talk to them and incorporate some of their traditions into their options, that goes a long way in gaining that trust as well. So again, yeah, accommodating that. Whenever possible, we should accommodate their customs. Some things obviously wouldn't be able to do in a setting such as a clinic, but there are probably some things that we can accommodate. So for an external source, this can be a poster in the clinic exam rooms. This can be something that's mailed off or just a handout to the patient. But with the chronic diseases that are prevalent for this group, addressing smoking cessation would be a big step in improving health for them. So I designed a flyer here, a poster using the sun in the background, as they're referred to, the children of the sun, and some of their beliefs of returning balance, so improving health through returning and addressing balance. So some of the things and the benefits here, I have a sense of feeling accomplished, healthier living, long life, and opportunity. All can come along with taking the steps to stop smoking, and then inviting them to address that with us. So again, this could be something great as a lead into a conversation in the clinic, or putting clinic contact information on here so that they have something that they can bring, that they have a way to touch with us and get those services. And that is what we have for the Spokane Indian tribe specific culture there.
Awesome, thank you. And then for our last group, we have the Hispanic culture, and that will be presented by Chrystal Gonzalez. Hang on.